Have you ever stopped to think that even with animals we see all the time, maybe a llama grazing peacefully or, a deer flashing through the trees, and there's this whole hidden layer, a world of biological complexity just beneath the surface.
Absolutely. Especially when it comes to things like health and reproduction, it's incredibly intricate.
It really is. And that's what we're diving into today, a fascinating, okay, maybe a bit specific, but really important area, vaginal defects in Camelidae and Cervidae.
Right. So we're talking camels, alpacas, llamas on one side, and then deer species on the other. Animals that seem quite different but share some potential challenges.
Exactly. Now, our sources for this are some really detailed research excerpts. They give a pretty comprehensive overview of these conditions, the ones animals are born with, and the ones they might develop later.
Mm-hmm.
And our mission really is to unpack all that for you. We want to break down what these defects actually are, maybe why they happen, how they're spotted, and, what can be done.
Sort of a shortcut to getting up to speed on a vital bit of animal health.
Yes. And you might find some surprising things along the way. And it really matters, doesn't it? I mean, think about the impact.
Oh, definitely. For farmers and breeders, it can mean real economic loss. For wild animals, it affects population health, conservation efforts. It's got broad implications.
It really shows how these seemingly small biological details can have huge ripple effects.
And what's interesting is how these conditions reveal fundamental things about biology, that delicate balance needed for healthy development and reproduction.
Yeah, it shows exactly where things can kind of go off track, either right from the start or, later in life.
Precisely. So, where should we begin? Congenital defects.
Let's do it. Starting at the beginning makes sense. So congenital defects, these are the ones an animal is actually born with. Problems that arose during development, right?
That's right. They're there from day one, stemming from issues during embryogenesis. It's a reminder of just how precise that whole fetal development process needs to be.
Tiny deviations having big consequences.
Exactly. A tiny hiccup in that blueprint can lead to significant challenges.
Okay, so one of the maybe more dramatic ones mentioned is atresia vulvae. That sounds pretty serious.
It is. Basically, it means the vulvar opening, the external opening, is partially or even completely absent, just not there, or maybe severely reduced.
So a physical blockage right from the start.
Yes. And the cause, the etiology, is generally abnormal development of those external parts during fetal life. The sources also mention a possible genetic link.
Ah, so some breeds or family lines might be more prone to it.
That's the suggestion, which, adds another layer for breeders to consider. It's not just the individual animal, it could impact the whole genetic line.
Wow. Okay, so if that opening isn't formed right, what happens inside? That can't be good.
No, it isn't. The pathophysiology, how it plays out, is fairly straightforward. If the urogenital sinus doesn't open properly, urine and reproductive fluids get trapped inside.
Oh, dear.
Yeah. And that buildup can lead to secondary infections or even pyometra, that's pus accumulating in the uterus. Very serious, very painful.
Gosh, that sounds awful. So what would someone actually see? What are the clinical signs?
Well, the most obvious thing is simply the absence of a normal opening. You might also see recurring urinary tract infections because of the blockage.
Okay.
Internally, if fluids are building up, you might notice a distended abdomen, or the animal might react painfully if you palpate, touch that area.
And breeding.
Difficulty or complete inability to breed is a major sign. And even if it's only partial atresia, if they somehow manage to conceive, they'd almost certainly face dystocia, a difficult birth.
Makes sense. So how does a vet confirm this?
It often starts with just a good physical exam, looking for that normal opening.
Right.
Then, to see the extent of the problem internally and check for that fluid buildup, imaging like ultrasound or maybe x-rays, radiography is really useful. Sometimes they might use an endoscope, like a tiny camera, for what's called a vaginoscopy to get a direct look inside.
Okay, so diagnosis sounds fairly clear. What about treatment? Can anything be done?
Often, yes. The main treatment is surgery, a procedure called vulvoplasty. The aim is to create or enlarge that opening.
To restore normal function, essentially.
Exactly. Allowing urination and hopefully breeding down the line. Of course, managing any secondary infections with antibiotics and pain relief is also vital.
And the outlook, the prognosis.
It really hangs on how severe it is. Mild cases might do quite well after surgery. But for severe cases, especially regarding future breeding, the prognosis is often more guarded.
Understood. Now, atresia vulvae isn't the only congenital issue, right? Particularly in camelids, llamas, alpacas.
Correct. Our sources mention several others, and one is actually described as one of the most frequently reported congenital defects in domestic animals generally.
Oh, which one is that?
A persistent hymen.
Mm-hmm.
So the hymen, which normally has an opening, is completely intact, imperforate. It forms a complete barrier.
Like a membrane blocking the way.
Precisely. And apparently a key sign can be actually seeing this membrane bulge or protrude at the vulva when the animal strains or maybe lies down.
Huh. That would certainly catch your eye. And the result?
Well, it physically prevents mating. And just like with atresia, it can cause fluid mucus usually to build up behind it in the vagina and uterus. That's called mucometra or mucocolpos.
Another barrier to reproduction.
Exactly. And then you've got things like vaginal aplasia.
Right. What's that?
That's where a whole section of the vaginal canal just didn't develop properly. It's incomplete, so you'd have a blockage further inside. A vet might diagnose that during a digital exam, feeling for where the canal ends abruptly.
Okay. Different from the hymen issue then. And vaginal septa.
Septa are like bands or walls of tissue within the vagina, dividing it partially. They can run lengthwise or across.
Like internal partitions.
Yeah. They result from an incomplete fusion of the Mullerian ducts during development. And like the other issues, they can interfere with mating and especially with birth.
Fascinating how many ways development can go slightly wrong. And then there's one that sounds really extreme. Uterus didelphys.
Ah, yes. That's rare, but quite remarkable. It's when there's a complete failure of those Mullerian ducts to fuse,
Leading to.
leading to basically two of everything: a double uterus, a double cervix, and a divided vagina. The sources even mention a documented case of a double cervix and divided vagina in a dromedary camel.
Wow. Just two reproductive tracks side by side. Incredible.
It really shows the range of possibilities when developmental pathways are disrupted.
Okay, let's shift gears slightly. What about congenital defects in cervidae? So, in deer, is it a similar picture?
Well, this is where it gets interesting because the picture is actually quite blurry.
How so?
There's a real scarcity of information compared to livestock. It's not likely because these defects don't happen in deer. It's probably because, in the wild, an animal born with a significant defect like these often just doesn't survive very long.
Ah, right. Natural selection is pretty harsh. They don't live long enough for us to find and study them.
Exactly. So these conditions likely go vastly underreported in wild populations. It highlights a gap in our knowledge about wildlife health.
Makes sense.
Yeah.
But their normal anatomy is complex too, isn't it? I remember reading something about the white-tailed deer's cervix.
You're right. It's quite intricate. The white-tailed deer cervix has, I think, 4 to 6 muscular rings or valves, creating this sort of complex, twisted canal.
Wow.
And while that's normal for them, it shows you the level of complexity where, theoretically, developmental errors could occur, even if we don't see them reported often.
Okay. And then there's a term that really jumped out, pseudohermaphroditism. What's going on there?
Yeah, that is fascinating. It's rare, but documented. You have deer that look female. Externally, they have a vulva, a vagina, but internally, they have testes instead of ovaries and a uterus.
So, genetically male but appearing female.
Essentially, yes. And as you'd expect, they are sterile. It's a really striking example of how sex determination and development can sometimes take unusual turns.
Absolutely amazing. Okay, so that covers the conditions animals are born with. Let's move on to the other side of the coin. Acquired defects, the ones that happen after birth.
Right. The wear and tear, the injuries, the infections picked up during life. These are often linked to things like difficult births, environmental factors, maybe even human interventions.
So different causes, but equally impactful. Let's start with acquired defects in Camelidae again. The sources mention vaginal adhesions. What are those?
Adhesions are basically scar tissue forming inside the vagina. Think of bands of scar tissue sticking things together that shouldn't be stuck.
And what causes that?
Often it's trauma. Trauma during a difficult birth dystocia is a big one. Or sometimes maybe unsanitary gynecological exams or procedures could lead to inflammation and scarring.
Yeah, and a consequence?
Well, these adhesions can physically block the vaginal canal. That makes mating difficult or impossible, leading to infertility. And unfortunately, scar tissue is notoriously hard to treat effectively, so the prognosis often isn't great.
Then there are actual tears, vaginal tears, and even rectovaginal tears. That sounds brutal.
It can be. The camelid vagina and cervix seem particularly susceptible to tearing during difficult births, and things like Aggressive obstetrical maneuvers, maybe trying too hard to pull a stuck fetus, or performing a phytotomy, which is dismembering the fetus to remove it.
Oh, wow.
Yeah, those actions can cause severe tears. Rectovaginal tears are especially bad because they create a fistula, an abnormal opening between the rectum and the vagina.
Leading to contamination.
Exactly. Fecal contamination of the vagina leading to severe chronic infections. It really compromises future fertility and the animal's overall health.
That sounds incredibly difficult to manage. Okay, and then vaginal prolapse. This sounds like more of an emergency situation.
It often is,
Yeah.
yes. It's described as relatively common, especially in heavy dromedary camels, typically in late pregnancy.
What actually happens?
It usually starts with the floor of the vagina sort of everting, folding inside out and protruding. But it can progress to the entire vagina and sometimes even the cervix being pushed completely outside the body.
Goodness. That must be incredibly stressful for the animal. What makes them prone to this?
Several factors seem to play a role. Advanced age, having had many previous births, high parity, and poor body condition. Interestingly, both being very obese and being very thin are mentioned as risk factors.
So extremes are bad.
Seems so. Lack of exercise, like in animals kept in stalls constantly, might contribute. And potentially nutritional factors, too, like selenium deficiency. It's often a combination of things.
Okay, a complex issue. Now let's turn to acquired defects in cervidae in deer. Same problems or different?
Well, again, the information is much sparser. Vaginal and cervical prolapse, for instance, is considered pretty rare in deer.
But not unheard of.
Not completely. There's actually a really interesting case report mentioned of a non-pregnant captive deer that had recurrent vaginal prolapse.
Non-pregnant, what caused it then?
It was linked to increased pressure inside the abdomen and the cause of the pressure. A large foreign body, believe it or not, a ball of string, plus gastroliths stones in its rumen.
A ball of string. You couldn't make it up. That really shows how unexpected things can trigger problems.
It really does. Cervical prolapse has also been seen in a swamp deer. And while the sources don't detail it in deer, vaginal rupture, a tear in the wall, is a known severe complication of difficult birth, sometimes associated with uterine torsion where the uterus twists.
Right.
There's an example given for a dromedary camel, just to show the severity, where a pregnant uterine horn actually prolapsed through a vaginal rupture. So the potential for that kind of severe trauma exists across these groups, even if we observe it less in wild deer.
Wow. That paints a vivid picture.
Yeah.
Okay, so we've covered a lot of specific conditions. Let's try to zoom out a bit, connect the dots on diagnosis, treatment, and the bigger picture.
Sure. Looking across the board, you see common threads in diagnosis. It nearly always starts with that hands-on physical exam.
The first step.
Yeah. Then imaging ultrasound, maybe radiography becomes key for looking inside, assessing the extent, checking for fluid. And endoscopy, the camera, offers that direct look when needed.
And for treatment. Surgery seems like a recurring theme, especially for the blockages.
It often is, particularly for those congenital obstructions. Vulvoplasty for atresia, maybe removing septa, but it's almost always paired with supportive care.
Right, the antibiotics for infection, pain relief.
Exactly. Managing those secondary issues is just as crucial for a good outcome.
And the prognosis, the outlook, seems to consistently depend on how bad the initial problem was and whether complications like infection set in.
That's a fair summary. Severity and secondary complications are the big factors. Early detection and treatment definitely improve the odds.
So bringing it all together, why should you, our listener, care about these, fairly specific reproductive issues in camels and deer? What's the broader significance here?
That's the key question, isn't it? I think understanding these details gives us really valuable insights into animal welfare, first and foremost, but also into the complexities of managing breeding programs for livestock, the economics, the genetics, and for wild animals, it touches on population dynamics, survival rates, the challenges of conservation.
It kind of connects the dots between individual animal health and the health of whole populations or industries.
Precisely. And it underscores the dedication and skill involved in veterinary medicine and wildlife management, trying to address these often hidden problems.
It's been quite a journey through this specific area of animal health. We've seen everything from missing openings at birth to, blockages caused by string, a whole range of congenital and acquired issues in camelids and cervids.
It really highlights the incredible intricacy of these biological systems and also the resilience of life. alongside its vulnerabilities.
So maybe here's a final thought to leave you with. We have this incredibly detailed understanding, relatively speaking, for domestic animals because we see them, we manage them, we treat them. But what about the wild species? Given that conditions like these probably just lead to low survival in the wild, meaning they go unseen and undiagnosed, what crucial knowledge are we missing?
That's a powerful point. How much is happening out there that we just don't know about?
Right. And how much more do we need to learn about wildlife health? And perhaps could the veterinary knowledge we gain from domestic animals, the surgical techniques, the understanding of causes, could that somehow inform conservation efforts for wild species where data is so scarce?
It's a really important question. How can we bridge that gap between what we know about managed animals and the hidden health challenges facing wildlife? What small piece of knowledge could make a big difference?
Definitely something to think about. So keep observing, keep being curious, because as we've seen today, even topics that seem niche can open up whole new ways of understanding the living world around us. Thanks for joining us for the deep dive.